Okay, somebody come up here. Just come up here. You've seen this before. Come on up. Pain is the sum of all its inputs. You have a chronic backache, and all of a sudden, it's been pretty good. Hadn't been bothering you, and all of a sudden, you get a bad cold, a flu or something. What happens? Your back starts to hurt, right? It's the sum of all inputs. So if you have cortical processing stuff that's going on in the brain, that hardware that's already bothering it, joints, limbs that aren't moving, range of motion that's altered, the brain's protecting, guarding something, that's an input that's going in. Bodywork, stress, massage, we lower that stress level in many, many ways to lower the output so there's not so much crap sensory information coming in. Equilibrium, which is balanced, equilibrium is not the same as balance. It's a taking away of everything to keep you stable. So what you do is, you've seen this before probably, it's been around. I picked it up from Vladimir Janda, and we're going to talk, like I say, again about him. I'm not a big muscle testing person, but we're going to do this right now. I just want you to push out against me. Keep your legs straight. Push out. Push again. Pretty strong. Okay, so she's pretty strong there. I'm going to take this wrist, internally rotate the wrist, and jam the wrist a little bit. Jam the carpal bones. I'm putting what? Sensory input in. Bad sensory input in, right? Doesn't like it, right? Resist me? She can't resist. That's just a little input. Now, this wouldn't stay, obviously, but pain is the sum of all inputs. So you get this back out and fix it a little bit. Resist? Okay, thank you. Good job.
Or bad job.
$50.
Yeah.
$50.